Hi everyone, welcome again to the Borderline Personality Disorder Family and Consumer Education webinar series. My name is Chris Palmer. I'm a psychiatrist here at McLean Hospital, also an assistant professor of psychiatry at Harvard Medical School. It's my pleasure to welcome all of you today. Today we're joined by Dr. Kelly Gunderson. Dr. Gunderson is an associate psychologist in the Gunderson Outpatient Treatment Program here at McLean Hospital, which specializes in treating people who are diagnosed with borderline personality disorder. Before we get started, I want to just go through a few logistical announcements. We want these webinars to be very interactive. Today's presentation in particular, we're hoping for a lot of interaction, a lot of questions, and a lot of discussion. Today's topic is one that has come up throughout the webinar series in terms of giving responsibility back to people who are suffering from borderline personality disorder, even when safety is an issue. And in order to promote the discussion, we have concealed your identity from other participants so they don't see your name, phone number, or email address. So instead, we want you to use the Q&A box in the lower right-hand corner of your screen. Type in questions, type in challenges that you're having, and we'll get through as many of them as we can. If you've come to today's webinar with a specific question in mind, feel free to type it in even now, and we'll put it in queue and get through it when we can. In the lower left-hand corner of your screen, you'll see links to several websites. That first one is our homepage, where all of the webinars that we've done are archived. If you haven't checked out that page, please do so. You can also register for upcoming webinars there. The next link is for registering for our very next webinar, and then the next three links are general resources on the topic of borderline personality disorder. Those websites provide education. They can also provide referral sources for treaters in your area. And finally, I just want to acknowledge that this webinar series was made possible through a philanthropic gift from a family affected by borderline personality disorder. We'd love to be able to continue these webinars. If you're in a position to be able to help us do so, you can click on the Support These Webinars link and give a gift, large or small, and we would appreciate it. And so now I'm going to turn the webinar over to Dr. Kelly Gunderson.
Thank you. Hi, everybody. So my name is Kelly Gunderson, as you've heard, and I thought maybe to begin with I would make clear who I am in terms of the relationship I have to the name, because many of you may be wondering. So I am John Gunderson's daughter, proud to be so, and as Chris said, I'm mostly in the outpatient clinic here at McLean Hospital working with families, some individuals, but mostly families at this point in my practice. So what I want to talk about today, and again, I'm really hoping this will be interactive and fun for people to participate in, but let me just sort of boil it down to some of the basics, which is about, essentially, the question of when do you lean in as opposed to when do you lean back and try to give more responsibility to your family member. This is can be made especially difficult when there is a question of safety and or threats of suicide. Many parents find the way to assuage their anxiety is to hover, try to get more involved, even get more controlling. The problem with this, however, is that it can leave people feeling depleted, exhausted, and even sometimes really resentful of the burden. But an issue for us to consider in this is that it's also not very effective. Parents don't feel effective, and often child or loved one doesn't feel particularly benefited. I would also say that it actually can have sometimes even the reverse of the intended effect. So I have many people in my practice who come in and say, you know, my parents believe in me, they say, you can do it, you know, you are bright, you are capable, you are competent. But then it feels to that individual like they're getting messages to the contrary, that the parents' behaviors don't exactly line up with those words. And over time, I think that this can be harmful in essence because the individuals start to feel as though little is being asked of them, as though family have given up on them or feel that they are unable to do for themselves. So what we know is that too little can lead to, increased demands for reassurance, proximity, seeking, and escalation and suicidality. But, too little is not so great, but too much is also not so great, as I said, and that it can leave an individual feeling sort of helpless and unable to sort of do for themselves. So what to do about this, right? That's why many of you tuned in. And what I would suggest is a kind of collaborative engagement. It asks both the family and the individual to engage in these conversations together. This seems really obvious, sort of the message of talk about it, but what I find is that many families and many of you who are listening today have found that either conversations go quickly very south, get very escalated, or where emotions run too high and the conversations really can't happen at all, and everybody feels kind of demoralized and helpless in the situation. So what happens is the conversations just stop happening. Many of you have probably had this experience where you stop even speaking together about these problems, even though it's sort of the obvious solution. So what I would say is have the conversations with each other. Many of the families that I work with know that one of my favorite phrases, and I use this often with people, is to say as a parent or family member that you have a dilemma. Now, this is my favorite word, dilemma, right? So the thinking here is that it allows for a shared process. So you don't have to, as an adult or parent or family member, know the answers. You don't have to have the right solutions. But you want to be a collaborator. And you slowly and over time want to have people start to engage in problem solving for themselves and coming up with ways that they think will work best for them, rather than sort of a top-down approach in terms of problem solving. It's okay to be in a state of not knowing, as parents. I think sometimes we feel like we're supposed to know all the answers and we're supposed to be able to figure these things out for our children. But the reality is we often don't know, and it's okay to say that, and it's often welcome to the child or loved one. So, just for an example, you could try saying things like, hey, Lulubelle, I have a dilemma. My inclination here is to come, help you clean out the apartment, help you pay your bills. And I'm all for it, but I'm a little worried that, kind of in the long run, that may be giving you the wrong message. Like, I don't think you can do these things for yourself. So what do you think we should do? So again, it's sort of a way of saying, I'm with you, I'm collaborating with you, I'm not going to do it for you, but how should we think about this together in a way that might work for you? So it's really, really crucial that we allow people to do some of their own problem solving and get engaged in the process. It can be a little tricky to do it gracefully, but it doesn't really have to be graceful. It can be clunky and awkward, but again, the idea is that you're trying to bring people into something that feels more collaborative and asks the individuals to take some responsibility for making some decisions and choices about how they take care of themselves. I'm not going to talk too much longer, but I will give you a kind of a funny little example of this kind of thing that I'm talking about from my own life. So over the weekend, I have a 7-year-old daughter, and she was on her said device, and it was time to get off. And I did what all good parents do, and I said, 1 minute, and you're off. Set the timer, 1 minute goes off, and, what do you think happens? Well, I'm not ready, I don't want to, 5 more minutes. Meltdown, crying, tears. It takes us 20 minutes to extract ourselves from this game that she was playing. So next day, Sunday, more time for her to be on her device. She gets back on, time is up, and this time I got smart and I said to her, we need to stop, but I know you're kind of in the middle of something here. So how much time do you think you need to wrap it up? And she said, 5 minutes. I said, okay. Set the timer for 5 minutes. Timer went off. And what do you think happened? She stopped, turned it off. No fuss, no whine, no muss. So in essence, I think, as it relates to the piece that I'm speaking to, it's, giving her some choice, giving her some say-so, and also sort of allowing her to be a participant in sort of the decision-making process. It worked much, much better. So just a small example from my own life. I think I'm gonna stop there and sort of pause and let people ask some questions, and happy to speak further about any of this. If we have more time and/or people's questions are, we need some more from me. Okay.
Great. Thank you, Dr. Gunderson. So we've already got a few questions in line, and I'm just going to preface, they're not easy ones to solve, but it'll be an opportunity for us to think through some of the different situations, and if we need more information from the participants, we'll maybe ask for that.
Okay.
So one person said, my 18-year-old son has been in a residential treatment center for 15 months now. He now, as an adult, is pressing to sign himself out. He wasn't admitted to the young adult residential treatment center because he's still too labile, and so he wants to leave. He wants to refuse further therapy, and he wants to accept, quote, help on a spiritual journey, unquote. We just found out this weekend that he has had a razor while at the residential treatment center and has still been cutting himself. Given how resistant he is to staying in the treatment center, what they asked is, can he really take responsibility outside of a highly structured residential program? I'm also going to phrase it more broadly. What's the role of the parent when they have this type of a dilemma? Because I think this dilemma speaks to the core of the title of your presentation. So my loved one says they want to take responsibility, wants to go off on their own, do their own thing, yet they're still engaging in unsafe, dangerous behaviors that obviously for parents is terribly concerning and alarming. And so parents are really kind of torn and in a dilemma of what am I supposed to do?
Sure. Well, I guess a couple of thoughts without knowing more about the situation. I think it's really important that parents be involved in the treatment process, so that, finding ways to speak to the team that he's working with, to see if he has any alliances with people there that he's working with, and to find out sort of what the current, how the professionals are understanding him currently and his level of risk. I think, so that's sort of one step. I think if your son says he's ready to leave, it's important that you express your grave concern and your disagreement with the decision, being compassionate about the fact that, of course, he wants to live his life and make his own decisions and not be in a residential setting. All that makes sense. But maybe asking him to think a little bit more about, what are the realistic possibilities for him if he does leave the treatment setting. Where would he live? Where would he work? How would he support himself? Asking him to really be thoughtful about some of those real practical concerns. Sometimes that can sort of ground people back into a place of saying, well, yeah, actually, I don't think I could really work full time, or I could get a job, but I haven't had any employment previously, or I'll come back and live with you guys. So there is also, I hate to use this word, but a little leverage in terms of the finances too. I mean, if you're supporting your child and or contributing to their living expenses, sometimes, I wouldn't lead with this, but sometimes there is a way in by saying, we really are going to support this or that, financially if you strongly disagree. But again, the main thing would be to try to really sit down and talk with your son in an open way, without too much emotion, and trying to sort of remain fairly neutral and really engaging him and trying to think about, how realistic his options would be should he leave against advice or before people think he's really ready. The last thing I would say is that you may also try to engage him in some thinking about how he would know he was ready to leave treatment. What are some of the goals that he or the treatment team has, and how would he operationalize those so that he has sort of a way of knowing if he's making progress and sort of an exit strategy. I find that sometimes when people are in residential settings for a long while, they get very kind of despondent and despairing about whether they'll ever actually be let go, and that can precipitate some of this wish to just flee. So if there's sort of clear expectations about, again, what progress would look like and what you as parents would support in terms of a more timely way of leaving, that would be good. I guess those are off the top of my head.
So it's a great start, Dr. Gunderson, and I'm going to be the cynicist, the cynical person, and push you a little bit. And
Sure.
And it's not that I disagree with anything you've said.
That's
I
fine.
completely agree. Everything you've said is right on target. And for some, it may be a perfect solution. And the son may say, well, yeah, now that you're putting it that way, I'm not sure where I would stay. Yeah, maybe I do need a little more time. The parents might say, we're really concerned about you continuing to cut yourself, and we see that as really problematic. We love you very much. It just makes us feel horrible that you're in such pain that you need to cut yourself, and would love for you to stay there and get more help. And so you've tried that approach, and then let's say the son responds with, you don't understand, you don't get me at all, you're just trying to keep me identified as a patient, I don't have the problem, you have the problem, I need to get out of here, I need to go out on my own, I have some feedback from the parent, my plan is I'm going to go across country, I'm going to hit up family members and friends for a place to stay. Maybe I'll hitchhike across the country. I don't know. If you want to help out financially, that would be great, but I'm not going to expect it from you. That's the plan.
Yeah. Well, there's always a kind of worst case scenario. No problem. I mean, the sad reality is that, when you have somebody who's a young adult, or 18 or over, who says they don't need anything from you, you can make your concerns known. But, I think leaving the door open, ultimately by saying, we don't agree with this, we don't think it's a good plan, we're really worried about this, it doesn't make sense to us, we're begging you really to rethink this. If all of that fails and the person says, I'm out of here, I'm doing this, you can't stop me, then in essence, you kind of have to let them go and hope that they don't crash and burn, but of course sort of expect that they might, and try to leave the door open for them to return if they're willing to continue or find treatment again. But beyond that, there's not really a whole lot else you can do. And so that's a very sad moment, for many parents and families when they have to sort of reach that conclusion that the person is going to have to try this on their own, and you just have to wait and watch.
Okay. Do you have any advice about how to keep the door open when there might be a moment like that? Sure.
I think keeping the door open looks like staying in touch, not really asking a lot about where are you, what are you doing, how are you in any sort of demanding way, but staying in touch by keeping it light, keeping it simple, sending a text saying thinking of you, love you, hope you're doing well, so nothing that's going to be received as overly anxious or critical, pushing the person away, but just a gentle sort of reminder that you're there, you're in support, thinking of them. So you stay in the person's mind. You don't, want to cut yourself off. but you also are not, leaping to the rescue either, is sort of I think the best approach.
Great. So we've got another question. I have an adult daughter with borderline personality disorder that still lives with me. Anytime that I try to tell her what duties are expected of her, she accuses me of not loving her and telling me that life is really not worth living. I feel stuck.
Yeah. This is a good question, one I run into often. I think you really want to hear what the person, your daughter, is saying, but also keep holding the expectation of her. So that might look something like, I know you get overwhelmed. I know you feel that the demands I'm asking of you are unreasonable or undoable. But, I really think you can do this. I really think that, it's doing you a disservice, in essence, to say, oh, no, I can't ask you to clean up after yourself. I mean, that seems to me like that's going to make you feel worse. And that, I need some help around the house. And, I think it's good if we are going to be living together to have some general expectations. And I do love you, and, sort of do some reassuring, but also hold steady with the expectation that that your daughter be actually contributing in specific ways. You don't want to get into threat making, but I think if you consistently have the expectation that she be emptying the dishwasher, making her bed, whatever the things are that she's now refusing to do, I wouldn't pay too much attention to the threats to kill herself. Those sound either more like she feels, life is asking too much of her, or as though, she's got a good way out in terms of doing the chores. But either way, I would say that, you be compassionate, but also hold to the limit of, this is just what reasonable people expect of each other when they're living together. And, I think you can do this. And I don't think it feels good to, end up reinforcing in a way that, you can't do these things, because what does that say? Again, I would just sort of try to also engage her and like, what do you think we ought to do? There's all these chores that need to get done, and I'm doing all of them, and that somehow doesn't seem quite right. Again, try to engage her in some of the problem solving, but also at the end of the day, just try to have a reasonable limit. Like, this is the expectation, and see what she does with it.
Great. So we have another question. My son is 22. He spent a year at McLean Hospital, and he's doing really great. He's back at college now and about to graduate. He seems to have overcome so many of the harmful behaviors that came with BPD for him, but he's still so very thin that I suspect or worry that he's still struggling with an eating disorder.
Yep.
I don't want to focus on the one thing that is bad when he's made so much progress. He's not cutting himself, he's not feeling suicidal, etc., but I also hate to ignore it.
Right.
He's not so thin that it seems like it's medically dangerous right now. And this parent goes on to say, I understand he's about to graduate from college. It's stressful for anybody heading out into the world, trying to figure out a job, trying to figure out a career path, be on their own. For him, given everything he's been through, at least this parent worries maybe it's even more stressful. And this parent is really concerned about all of that stress leading to a recurrence of some of the suicidality or depression or cutting behaviors. And so any advice for this parent? So I think the pointed question is bring up the thinness and the possible continuing eating disorder or not.
Yep.
And then I would love for you to broaden that, because I think that's a great point, or it's a great example of a lot of parents feeling like, oh, there's room for improvement here in my child, or this thing they're not, they've come a long way. but this, they're still not great with their finances, or they're still not great with housekeeping, or they're still not great with this, that, or the other. And I think, again, this topic speaks to that dilemma for a lot of parents of wanting to either micromanage, like, good citizens do these things, versus letting them go and letting them do what they want, even if it's not exactly what the parent would desire.
Sure. Yeah, no, I think that's well put. I think, well, I guess first I'm kind of curious why this parent would feel like she couldn't bring it up. I wonder if there's just a backlog of, voicing concerns and having them either not go well or be received well, or so that, I guess that's just one thing I found myself thinking about. Because if that was the case, there might be some good reason not to bring it up. If you have somebody who's more oppositional, for example. But in general, I would say if you have a worry, it's okay to voice it. That's not leaning in to say, let me fix this for you, let me find you a therapist, oh my God, you're so thin, what are we going to do? It's just sort of saying, you've come such a long way, and we're super proud of you, and you've accomplished so much. And yet we worry about this one remaining piece. And do you worry about it? Do you have, are you concerned? Is it something that you're thinking about? And if so, is there anything that we could do that would be helpful? So you're kind of naming it, but you're not really trying to solve it per se. But I think it's okay to mention a concern. He may not like it. He may say, back off, and I don't want to hear from you about this, and I got it under control, and none of your business. But, it's registered, so I think it's okay to say, it's just a concern, observation. I trust that you can handle it, and you've accomplished a lot, but, I can't help but sort of notice this one piece. Somebody's physical appearance is a more obvious, thing to be concerned about in terms of weight.
Great. Yeah, no, good. The next question comes back to the idea that we were talking about of holding limits and asking your child to contribute.
Yep.
Do you have ideas or recommendations for consequences that would be appropriate when they do refuse, especially for an older teen or a young adult? Yep. And so let me leave it at that.
Sure. Well, again, I think consequences can take lots of different forms depending on sort of age level and, financial dependence or not. So if an adult child is living with you or an adolescent living with you, you hold probably more of the purse strings. So it's, I think it's okay to say, well, I'd like to have you contributing to the household in X, Y, Z ways. If that's not happening, I'm not so inclined to really pay your cell phone bill or give you rides or pay for your new sneakers, but whatever it may be that, where there's sort of a financial incentive. I wouldn't start incentivizing kids with all, an allowance, like if you do them, I'll pay you. I would keep it as this is just a basic expectation for like what we all have to do, and nobody likes it very much, but I would really appreciate it and would mean a lot to me if you could do this. That's another way of coming at it, which is just, if you don't want to bring in the finances or somebody's financially independent, you might just try leaning in with the sort of more personal statement about it feels really hard or demeaning or sad for me when you don't do these things because it makes me feel kind of used and abused. So I'm sure you don't want me to feel that way. It would just mean a lot if you could help out, even in a small way. So again, you're sort of personalizing it a little bit more without saying you're bad and you didn't do your chores, but sort of like, hey, this would really mean a lot to me if you could do this. I know it's hard and I know it's unpleasant and nobody wants to do it, but it would mean a lot around the house, and we'd be really excited if you could do some of this stuff. So that's another way of coming at it. It's hard to take things away from people, especially when they're dependent on them, like our cell phones, our cars, things like that. But I think ultimately, it is important to sort of hold a limit in terms of what you expect and stick to it. That's the hard part.
Yeah. The next question is, and this is a question that comes up almost every webinar we do, in terms of a loved one who refuses to get help or acknowledge that there's a problem. So this person specifically asks, I can't talk with my son about much, including him getting help. He either doesn't see or doesn't want to see how badly he needs it, and says everyone else, including me, are the ones that need help. How do I approach this when I clearly see him just going down a downward and dangerous spiral? Is there any role for a family intervention or some type of an intervention?
I'll answer the question. I was thinking that for all the people who have done these webinars, I can't believe somebody hasn't come up with a good enough answer to this question such that it keeps recurring. I'm joking, because actually there is no really good answer, which is, I'm sure, why the question keeps coming back. But in terms of this particular instance, I think you're in a really, really tough position. Sometimes if you can gather support in terms of other family members, or even having your own therapy, that can be helpful in terms of trying to figure out the delicate balance, right, between, and I don't mean to worry too much about diagnosis, but the sort of externalizing, it's everyone else, you're the problem, the world is a terrible place, I'm doing my best, I just keep getting, the wrong short end of the stick, those kind of statements may sort of point to a little bit of more of a narcissistic character structure. And in that case, you just need to be careful and keep in mind that person, and I'm sure your son as well, probably does have some awareness deep down inside of themselves as the problem, but it's just too painful and intolerable to look at or to be able to hold on to. So it's not so great, it's not helpful to sort of point that out, but if you can keep that in your mind, sometimes that sort of helps you take a breath and not feel as critical or as angry with the individual, or with your son in this case. Getting people to go to treatment and to reckon with their own problems is really hard to do. And I think sometimes, again, if you're financially supporting them, they're living with you, sometimes you have more of a way in terms of you really need to try this. But again, if somebody really doesn't want to go to treatment or therapy, they're not going to get much use out of it, then you really are kind of in a tough spot. I think gentle reminders of, hey, you don't seem so happy, kind of moving it away from whether it's their fault or somebody else's fault, but just sort of getting to the crux of sort of observations about, you don't seem fulfilled, you don't seem like you're enjoying life much, and I'm concerned about that. It seems like there might be options for ways you could feel better. Wouldn't it be worth trying to talk to someone? I don't have the answers. You don't have the answers, but maybe somebody else would. Again, moving away from sort of arguing with the individual about whose fault it is, or trying to get them to look at themselves, but just sort of acknowledging what must be true, which is the person can't be very happy living in that way. And sometimes that will soften things a little bit, or allow a person to just acknowledge, how unhappy they are, and that can be sort of a starting point. But I think it's very difficult to get people who are kind of brittle and or walled off and don't want to look at themselves to really engage much in work, in therapy work.
Okay. No, great. So we got a little bit of follow-up information.
Okay.
He won't go to any treatment or psychotherapy. The only time we've been able to get him into any type of treatment is hospital ER visits for suicide attempts. So building on what you just said, it seems, I'll ask, but it seems like that might be a very clear, objective marker for this parent to continue to bring up with their son of, I'm just concerned that you tried to kill yourself, and it sounds like attempts is plural, and so I'm just concerned that you've tried to kill yourself several times, and I don't know how to help you with that. Clearly, it seems like there's a problem if you were driven to do that, and wish you would get some help.
Yep. I think repeating that kind of thing is right on the money. I mean, there's not a whole lot you can do other than that, but I think just as you're saying, acknowledging, like, the reality is you've been in and out of the ER with multiple suicide attempts, and, we as parents are really anxious. We worry about you a lot, and we don't know how to understand this. It seems, discrepant with the rest of your life, or with your statements about that you're fine or that you don't need help, that something's not right here, and we really don't know how to help or what to do, and we're really desperate and really asking you to reconsider this, something like that.
Great. So the next question is about a 16-year-old daughter who's been in residential treatment for 2 years now. In this program, she's home on weekends and holidays and vacation time. When she comes home, she pushes for the freedoms and privileges that many of her peers enjoy. And it seems I have two dilemmas. The first dilemma is that her social judgment is more like that of a pre-adolescent. And second, even in areas where she does do better in her choices and behaviors, I feel like I'm 2 years behind. She left home when she was 13, and without doing much of the parenting, she's 2 years older, and I haven't really had the chance to move along the developmental path with her to really understand what she's capable of and maybe what areas she has some weaknesses or some vulnerabilities. Any advice or suggestions for this parent?
Sure. You might try coordinating, depending on what kind of residential program she's in, you might try coordinating or having a team meeting with her therapist or a therapist there in the residence, to try to talk about this, in the format of, hey, what is appropriate, because it's hard to know what her limitations and or, strengths and weaknesses are. You may have some sense of it, but if you can get her to actually think about it, collaborate with you, so that, again, it's not so much you saying you can't do this, you can do this, this is appropriate, this isn't inappropriate, sort of engaging with her and maybe, as I said, the rest of her team in the discussion about, like, what would a good weekend look like? What are the things that would be reasonable and safe for her to do, and what are the areas where she's still having challenges or difficulties, and how could she work with you and or with her treatment team to sort of think about these things in an open, collaborative way, so that, again, it's not you saying you can't do this, you can do this, but saying to her, here's my favorite phrase, we have a dilemma. As parents, we want you to enjoy things, we want you to have fun with your friends, but we also know, you're in a slightly different situation than maybe some of your peers, and we don't want to overshoot and we don't want to undershoot. So could we sit down and talk about this or think about this together, so that you feel comfortable and we feel more comfortable, something like that.
Great. So we are waiting for more questions to come in.
Okay.
You mentioned that you might have a little bit more material of general topics that you might want to cover. So while we're waiting for any other remaining questions to come in, I'll at least give you that opportunity.
Okay. Yeah, sure. Let me just check back here about some of the things I didn't do. I guess another part of this that I hear often from families is the piece of it where everybody's avoiding having these kinds of discussions, because as nice as I make it sound, they don't happen in that way. That sort of engaging in the questions about treatment, no treatment, privileges, no privileges, and that those conversations really don't tend to go very well. So, many times families will come in and sit with me and say, well, that all sounds well and good, Kelly, if everyone was calm and everyone was thinking straight. But the problem is these topics come up usually when somebody is upset, angry, frustrated, emotions are running high, and then these kind of more calm, collaborative conversations are really difficult to have. So I guess I just kind of wanted to acknowledge that as easy as this sounds to do, you all know from your own experience that it's really hard to pull off well. And that, I think, in turn, just breeds more avoidance, understandably so, when these conversations go poorly. Nobody wants to have them. And so as almost sort of obvious as it may seem, it can be really difficult to make happen in a very effective way. So I guess I would just suggest that, to try to have the conversations not in the middle of an argument, not when you're in high emotion, not when the child or loved one is in a sort of high emotion state, but to think about the question of how do we join with this person that we love, try to see the world through their eyes, try to understand how they're feeling about things, and also try to hold for our view of things or how we're seeing the situation. And you're holding both in your mind at the same time, which is a hard thing to do, but many of your loved ones are being asked to do that in their therapies and treatments if they're in them, and it can be a really important part of how you connect. Because ultimately, even if you're fighting, yelling, screaming, at the end of the day, you really want the best for this individual. And so kind of keeping that in mind and trying to lower emotion where you can and not engaging in these kinds of conversations when there's a lot of upset or high emotion.
Okay, great. We've got several more coming in now. They're just coming in like gangbusters. Okay. But so one question I want to start with is, and I think this is a common dilemma. I know there's not a clear, easy answer, but if you can share some insights. So one dilemma that I've seen occur with many patients and many families is the dilemma of the loved one with borderline personality disorder genuinely feeling and believing that they are helpless, they are vulnerable, they are going to need to be taken care of the rest of their life, because every time they have tried to be responsible or every time they've tried to be independent, things just melt down. They don't have the self-confidence. They don't have the frustration tolerance. They are too sensitive to criticism or rejection, and they get overwhelmed. They kind of melt down. They feel suicidal. They feel like it's too much effort, it's too much work. And so if the only alternative, if parents, if you're telling me you're not going to take care of me, then you're not going to be my source of support, they really do feel and believe that suicide is the next best option. And I know sometimes people get hung up on, well, they're manipulating you, and from a behavioral analysis, they're making you continue to enable them, and I actually think for a lot of people, coming from the perspective of the identified patient, it really is a sheer sense of hopelessness, given that scenario, at least in some cases, I think it really poses a tremendous challenge and dilemma to parents because they actually authentically sense it too, that like, no, she or he really will kill themselves. Like this really, if I push them out of the nest, or if I expect too much of them, and then hold the line and take away sneakers, take away cell phone, take away, they're going to go try to kill themselves. They've tried to kill themselves over seemingly lesser stressful things. And so for those parents who at least feel like they're in that situation, any guidance on the types of conversations that could be had, or any guidance on treatments or anything that can help move people out of that situation?
Yeah. Well, in that scenario that you're describing, I think it sounds like that individual or that child really also has some major skills deficits. And depending on what kind of treatment they're in, DBT, mentalization, there's some multiple good evidence-based treatments out there, but getting them to sort of increase their skillfulness is one thing that sounds important in this scenario, right? Because the person's still melting down, the person's still feeling unable to cope, not able to manage their emotions without sort of getting waylaid by them. So there are treatments that individual could and probably should engage in if they're sort of at that level of sort of disorganization and dysfunction, that they can't hold a job, or they can't be in school, they can't do chores. I think it's sort of okay to say, well, this is really impacting your life, and there are ways you can get more skillful so that you can feel better about yourself. Now, what I often tell parents, too, in this scenario is it doesn't feel good for the individual to be dependent. In other words, they say that it feels worse, to be all alone or to have the experience of being left alone. The dilemma, right, is that they don't feel good living at home with no job, no friends, no school, no structure, no nothing either. So sometimes I'll say to parents, the way in here is to remind yourselves that this person isn't happy, they don't have a full life, and to sort of recruit them back in by saying, we got to do something, because the solution for you to live in avoidance, in essence, of the stressors, the triggers, all the things in the environment that cause you to feel so terrible, can't be eliminated, and so we need to learn how to better manage, and you need to learn how to better manage. So it can be a we statement rather than you need treatment, you need therapy, you're unskillful, you're a mess. It can be we as parents need to figure some things out about how we've kind of gotten to this place where you're at home and you feel so overwhelmed. Like, clearly we haven't done something well. Sometimes that can feel welcome because it's about sort of parents saying, hey, we're part of this problem too. And getting some parent guidance, that can be really helpful. But also, I think to be able to say to the individual, it doesn't have to be this way. It feels that way and you feel like you failed over and over again, but maybe that's because you haven't had the tools to really manage differently. So perhaps if we find ways to get you those tools, you won't have this experience over and over again of failing or, blowing up or imploding when stressful things come your way.
Great. This next question, in many ways, is a great question because it speaks to so many levels of caretaking that parents feel. So do you have any thoughts on checking for sharps in our teenage daughter's room, given that she is continuing to cut herself?
That's a good question. I tend to feel, sadly, that where there's a will, there's a way, and you could take sharps out of someone's room. But if they have access to the kitchen, if they have access to the drugstore, it's not usually the solution. But even with your teenage daughter, I would sit down and say to her, you know, we know this is continuing to happen. We're so tempted to go into your room and make sure there's nothing there that you could hurt yourself with. We don't want to invade your privacy. But what do you think we should do? Would it be reasonable for us to, have you let us know when you're seeing improvements in self-harm so that we can not be doing that? So there's different, basically I think you want to try to engage her in a conversation about it, and again the dilemma being we don't want to invade your privacy, but on the other hand we really don't want to see you hurting yourself, and we especially don't want to see you doing it, you know, in our home, in your bedroom. We just, you know, that's really hard for it's really hard for us to tolerate. What do you think would be helpful, and how can we talk about this in a way that opens it up a little bit? Again, I think the risk is that if you go into the room when your daughter's not there and you take away all the sharps, she comes home, she finds this, she explodes, she yells, she's upset and angry, sad, feels more self-destructive. That isn't necessarily the way you want to go, but I can certainly appreciate that it's not a very good feeling to imagine that someone's cutting themselves and you're allowing them, in essence, to do so while they're at home.
Great. So the next question is also a good question. We're trying to decide when to give back car privileges to our 23-year-old after numerous speeding tickets, suspension, and a DUI in his late teens. How do we think about trusting him with this responsibility? He's much healthier now. He's not displaying the same risk-taking behaviors, but this is terribly frightening for us.
Sure.
At the same time, he's asking for this privilege, and he feels like not having this privilege is holding him back in his life.
That's a good question. The car comes up a lot. I have that question a lot with families. So if you're seeing that he is more stable, that he's managing his emotions better, that there's some sort of qualitative and quantitative differences in how he's organized himself, meaning, you know, he has a job or he's in school and he's been able to sustain some kind of consistency for 6 months to a year. I would say 6 months minimally, a year more likely. If you see that your son has been able to do this sort of function, manage emotions, maintain himself while also enduring some stressors, right? So he's not just in a bubble or a cocoon. If you're seeing him navigate differently and you feel in your gut like there's a real difference, then I think it is reasonable to move towards allowing him access to the car. I think I would try to go a little bit gradually, and maybe you say, you know, like, let's try having you use it to and from work, or let's try having you use it during the daytime hours, but not at night for the first 6 months, or something where you're kind of saying, hey, let's give this a try in a way that feels like a good trial, but isn't just sort of saying, here's the keys, go ahead, do whatever, whenever. That can feel a little infantilizing for a 23-year-old, so it may not feel great to everybody. But again, I would say, hey, here's our dilemma. We want you to have the car. We want you to have, you know, a life. We want you to be able to get around to places. But we know the history. Help us think this through. Like, what, you know, scratching our heads. What do you think would be reasonable? How should we go about this? Sometimes you'll get young adult kids to be more workable and collaborative when you involve them or include them in some of the process of the decision making, and you're giving them some say-so in the process.
Great. So the next question is, our soon-to-be 18-year-old daughter has recently returned home from 16 months of treatment in a residential treatment program and then a therapeutic boarding program. She's doing well and trying really hard, yet we are very worried about her given her past. How should we react in general? How should we as parents react when she makes good decisions and when, alternatively, when she makes bad decisions or unsafe decisions, let's say? And how can we explain to her why her younger sister has more freedoms, responsibilities than she does?
Okay, well, the first part in terms of...
Good decisions.
Yeah. Good decisions, poor decisions. I would try to remain fairly neutral and not sort of overly praise or overly criticize. So if you see her making a good decision, something kind of neutral like, I like your thinking there, or, looks like you got your thinking hat on, or, something that's, again, not too praising, but also just sort of an acknowledgement of, I like how you thought that one through. Again, poor decision making, I would tend to kind of not delve too much into. Chances are she's going to know if she's made a bad decision, and if it's nothing too serious, I might ignore it. Or if she's distressed about it, then you have an opportunity to say, in retrospect, well, how might you have done this differently, or even some sort of normalization of almost every 18-year-old makes bad decisions, some good decisions, some bad decisions, so you can kind of try to normalize it a little bit. But at the same time, with the younger sister who's having more privileges and responsibilities, I think it's also worth noting, this is really hard. It must be really hard. You're older, you've been through a lot, you've had experiences that are difficult that your sister hasn't had or your brother hasn't had, and we're working towards, you getting back all of those same kind of privileges and responsibilities. We really want that for you, and that's the path that we're on. So you kind of reassure her that that's where you're hoping things will go, and she's got a big part in the decision, right? So that, she can do what she needs to do on her end. You're more than happy to start increasing privileges and responsibilities, and that would be the expected course.
Great. So the next question is, our 20-year-old daughter, who lives at home with us, is in treatment for an eating disorder. She withdrew from school on her own in order to do this treatment. We're supporting her in this level of treatment, and but we also worry or suspect that there might be some drug abuse going on, but we're really not sure. And what would you do? Person says, I expect you'd say, is this happening? And ask her directly. But do you have any advice for how to frame that type of a conversation when the parents aren't even certain that it's happening?
Right. No really good way. I think other than to just put it out there as a question, and you can say, this could be unfounded, but we feel enough uncomfortable or enough worried about this that we feel like we need to raise it. And it's not to insult you, it's not to, pathologize, it's just really to be curious with you about whether this is going on, because what we don't want is to have all the progress that you're making while working on the eating disorder or having a semester off from school and not be really addressing the whole picture, or not be addressing something else that might be going on simultaneously. And sometimes you can get people a little bit more interested when you're saying, you're taking all of this time and energy to do this treatment. It'd be too bad if you sort of were, short shrifting yourself in not sort of dealing with all of it, whatever that might be. So that's our worry, that we want to make sure that you really are maximizing all the benefit that you could be getting. Something like that.
Great. So with that, I'm mindful of the time, and we're going to have to end. I thank you so much,
my pleasure,
Dr. Gunderson, for being with us and for all of your insights. And I think this is a really pertinent and relevant topic, and I hope that you have conveyed some really useful information to our audience members.
I hope so too.
I want to let people know about our upcoming webinar on narcissistic personality disorder, by Dr. Elsa Ronnie Stam. That's March 15th, so you can click on that link and register. And with that, we will